Young adults around the world are facing growing challenges to their mental and functional health. Rising unemployment, social fragmentation, poor diets, and unstructured digital exposure are affecting emotional resilience, cognitive clarity, and social connectedness. The Global Mind Health 2025 report highlights the potential long-term impact on education, employability, and overall productivity. To explore what these findings mean for health systems and how managed care can respond, we speak to Ayesha Kriel, Functional Head of Disease and Medicine Management at Medscheme in South Africa. Ayesha, good morning, and thank you for making time to chat to us this morning.
Good morning, Asanda, and good morning to the listeners. Thanks for having me.
It's our pleasure. So the Global Mind Health 2025 reports, it's painting a worrying picture when it comes to young adults worldwide. From your perspective, how are South African youth faring compared to these global figures and reports?
So I think South Africa is pretty much following global trends. Based on this report, we are doing well as the youngsters. We are doing well from a perspective of spirituality and social connectedness. But with all the other dimensions that they've looked at, we are not doing very well. We are seeing an overexposure of especially the young adults to social media, to digital tools, etc. And we see them moving away from family connections and from real solid coping mechanisms when it comes to their mental well-being.
So let's take a look at some of those factors that have been raised. Social fragmentation, early digital exposure, and poor diets being key drivers in declining mental health. Which of these would you say are the most pressing challenge when it comes to the African continent?
Yeah, so the report identifies early smartphone usage. So I think children at a younger age are starting to be exposed to smartphones and with the resultant social media exposure. So that comes up tops as a major challenge. Then also nutrition. So we see a high utilization of ultra processed foods, fast foods, to be quite specific. We see high food consumption that's not really healthy. And then, as I've also mentioned, the weakened family cohesion and then the declining spiritual engagement. So people are not as well-rounded emotionally, physically, as they used to be. Those are the key factors that are really playing the role. But in South Africa specifically, it's that high mobile penetration, which is a problem. We are the highest users of cell phone and smartphones globally.
So let's take a look at that. We normally focus on diseases or treating them once they appear. But the report is emphasizing functional mind health as a foundation for long-term well-being, which one can't just read by looking at someone. How is Medscheme integrating mental and physical health in its value-based care approach?
So, previously we always, I think in the South African health industry, we've always looked at mental health as sort of a separate disease. But we've realized based on academic research that our mental health is inextricably linked to chronic disease and chronic disease control. So within the Medscheme environment, for example, in our diabetes value-based care unit, we start off whether the person is newly diagnosed or whether they are already suffering from the disease for quite some time. We immediately start our first engagement by doing what we call mental health screening, because that helps you understand where that person is at. And we need to meet that person where they are at. And by that I mean where they are at in their life, where they are at in their work environment, in their home environment, and that will form the basis of how we engage with them. Because if they are not engaged, it impacts how they actually take the medication. It impacts how they view their chronic disease and how they view what chronic disease control is. So we need to get the mind right. We need to get the emotional stability measured, so that we can engage with them more effectively, because then they're actually open to receiving information from us about their own condition. And that is how we practically implement it, because you then optimize both the physical condition and you optimize the psychological well-being, and you help that person then sustainably going forward, so that after you engage with them, they can continue that and self-manage and apply the coping mechanism skills that we hopefully will empower them with.
As we talk about empowering, what immediate steps would you encourage in terms of practical steps for improving functional mental health among South Africa's youth? If you could recommend one immediate step specifically for South African youth.
I think do yourself a favor, and do the assessment online. There are many free mental health assessments online. Do the assessment and see whether any of that resonates with you. Do you have trouble sleeping? Are you constantly stressed? Don't you want to wake up in the morning? Do you dread facing the day? Understand what your triggers are, and understand actually what it is that is challenging you at the moment. I think for me that would be the first step, is recognizing and understanding where you are, and then decide what you need to do to address the various factors. So if it is that you've identified that sleep is a problem, seek medical help. Visit your GP or your clinic or your pharmacy clinic, and try to address that issue. If it is work stress, if it is school stress or volume of work that you are doing, volume of school work, then you address that accordingly. So I would say the first step is understand what your major or your significant challenges are, and then you deal with it accordingly, because it will differ for every individual. That would
Right.
be my
Ayesha, we'll leave it
advice.
there for now. Thank you so much for talking to us this morning.
Thanks very much for having me. Have a good day.
Thanks.
Bye.
You do too. Ayesha Kriel is a functional head of disease and medicine management at Medscheme, discussing the Global Mind Health 2025 report and the importance of integrating mental and physical health. Right, it's Rise and Shine on Channel Africa. We are first with the African story globally. My name is Asanda Peta. Let's catch you up on the news update as we enter the third hour, the final one of the show. Here's Jolane Tulo Mwepe.